Imagine waking up one morning, feeling as though the ground beneath you has shifted, as if the familiar rhythm of your body has suddenly betrayed you. For many, life moves steadily, day by day, in patterns we assume as stable, predictable, and safe. But then there are moments when reality reminds us of its fragile, unpredictable nature. Moments when our health, our strength, or our sense of control wavers in ways we cannot anticipate. Chronic kidney disease, often considered a slow and silent adversary, sometimes chooses to act swiftly, catching patients off guard and forcing them to confront vulnerability in its rawest form. It is in these moments that the wisdom of experts like Dr. Mathew R. Weir becomes not only a guide, but a lifeline, illuminating the path forward amidst uncertainty. He teaches that while the body may falter, the mind and spirit have the capacity to respond with vigilance, courage, and deliberate action. This is not merely a lesson in medicine, it is a lesson in life itself. The human experience is defined not by how we avoid adversity, but by how we recognize it early and respond with clarity, intention, and resilience. Just as a river can change course with sudden rainfall, so too can the trajectory of our health shift unexpectedly, reminding us that complacency is not an option. Infections, dehydration, and certain medications, each seemingly ordinary in our daily lives, can act as unseen catalysts, transforming manageable conditions into urgent crises. Recognizing these triggers before they escalate is akin to noticing a small crack in a dam before the floodwaters break through. The difference between prevention and devastation lies in awareness, timeliness, and decisive action. Yet awareness alone is not enough. It must be paired with discipline, a willingness to listen to the subtle signals of the body, and the courage to seek help without delay. Dr. Mathew R. Weir emphasizes that understanding these warning signs is an act of empowerment, a conscious choice to reclaim agency when circumstances threaten to take it away. Life, much like kidney function, is not linear, and the sudden deterioration of health can serve as both a wake-up call and a catalyst for transformation. The challenge lies in confronting uncertainty without succumbing to fear, in observing symptoms without denying their significance, and in accepting that the journey toward wellness requires both patience and urgency. The human spirit is remarkably adaptive, yet it thrives only when we combine knowledge with action. The decisions made in these critical moments, hydrating properly, avoiding harmful substances, consulting healthcare providers promptly, may seem small in isolation, but collectively, they determine the course of recovery, preservation, and survival. Beyond the physical, there is a profound psychological truth. Preparedness is a shield against despair. Patients who educate themselves, who anticipate potential triggers, and who understand the mechanics of their condition, often navigate crises with greater confidence and clarity. It is a reminder that wisdom, preparation, and mindful vigilance are as vital to survival as medical intervention. Dr. Mathew R. Weir that underscores this principle repeatedly, highlighting the synergy between medical knowledge and personal responsibility. To ignore early warning signs is to invite a preventable tragedy. To act decisively is to honor the resilience of the human body and the enduring capacity of the human mind to rise above vulnerability. Just as a gardener tends carefully to the fragile shoots of life, protecting them from sudden storms, so too must we nurture and protect our health with foresight, diligence, and respect. Each choice, each action carries weight. Awareness without action is inert, and action without knowledge is blind. In this delicate balance, we find both the challenge and the beauty of life. The call to remain present, attentive, and courageous, even when circumstances feel overwhelming. Rapid deterioration is frightening, yes, but it is also an opportunity, a stark, unyielding reminder that vigilance and proactive care are not optional, but essential. It compels us to pay attention, to listen deeply, and to act without hesitation. In this interplay between fragility and resilience, between risk and empowerment, lies the transformative power of understanding and embracing the wisdom offered by those who have dedicated their lives to studying, teaching, and guiding patients through these moments of sudden uncertainty. Dr. Mathew R. Weir, that reminds us constantly that knowledge, mindfulness, and timely action are the true allies against the unpredictable currents of life and health. Those who recognize this truth do not merely survive, they thrive, turning potential crisis into opportunity, fear into clarity, and vulnerability into strength. The question we must all ask ourselves is not if adversity will come, but how prepared we are to meet it with awareness, courage, and deliberate care. There is a moment, often unexpected, when the calm we have taken for granted gives way to tension we cannot ignore. A sudden shift in our health that feels almost like a whisper at first, then a roar we cannot deny. For many living with chronic kidney disease, this moment comes as an abrupt deterioration, a reminder that the body, though resilient, is also profoundly vulnerable. It is here, in the quiet spaces between uncertainty and fear, that the importance of awareness becomes starkly clear. Infections that seemed insignificant, a day spent dehydrated, or medications taken without caution can suddenly ignite a cascade of consequences, pushing kidney function toward a critical decline. The suspense lies not only in the unpredictability of these events, but also in the realization that the window to act may be narrower than we anticipate. Dr. Mathew R. Weir teaches that understanding the mechanics of the body, respecting its signals, and acting promptly are forms of courage that often go unseen until they are most needed. There is a profound lesson hidden in this delicate balance. The line between stability and crisis is often thinner than we imagine, and the difference between preservation and irreversible damage lies entirely in awareness and timely response. Imagine the sensation of standing at the edge of a precipice, the ground trembling beneath you. One step forward, one decision delayed, and the consequences may be irreversible. Yet it is precisely within this tension, this suspense, that the opportunity for transformation emerges. The human mind, when attuned to both danger and potential, becomes an instrument of survival, capable of extraordinary clarity and decisive action. Rapid progression in CKD is not merely a medical event. It is a profound metaphor for life itself, reminding us that preparedness, mindfulness, and vigilance are essential in all areas of existence. Dr. Mathew R. Weir, that emphasizes the critical nature of early detection, not as a source of fear, but as a guide for empowerment. Recognizing subtle signs, fatigue that cannot be explained, swelling that seems unusual, sudden changes in urination patterns, is not just a matter of clinical observation, but an act of self-respect, a commitment to protect the body that sustains us in every moment. And yet, the suspense of these changes cannot be overstated. The progression may appear sudden to the untrained eye, striking without warning, and leaving those affected scrambling for answers. In these moments, panic is natural, but panic is not productive. What is productive is knowledge, action, and an unwavering commitment to respond with clarity and precision. It is in the understanding that even small interventions, hydrating adequately, monitoring symptoms carefully, adjusting medications under professional guidance, can create monumental differences in outcomes. The mind that remains calm, observant, and ready is the mind that turns potential catastrophe into opportunity. Every choice, every act of vigilance, every moment of attention to the body's messages contributes to resilience. And within this, there is hope, even amidst suspense. Dr. Mathew R. Weir, that reminds us that fear should never immobilize us. It should sharpen our focus, refine our decisions, and elevate our sense of responsibility to ourselves and to those who depend on us. It is in this heightened awareness that courage is cultivated, not the absence of fear, but the decision to act in spite of it. The suspense of rapid health deterioration also teaches patience, discipline, and humility. It reminds us that life, like kidney function, is not entirely within our control, but how we respond is. The ability to anticipate triggers, to seek guidance, and to intervene swiftly can prevent permanent loss, preserving not only kidney function, but the quality and fullness of life itself. This awareness is not meant to intimidate, it is meant to empower. Every symptom noticed, every precaution taken, every consultation sought, is a small but decisive act of reclaiming agency in the face of uncertainty. Life, like kidney health, is a series of moments demanding attention, care, and intentional action. And in these moments, the teachings of Dr. Mathew R. Weir serve as a beacon, reminding us that informed vigilance transforms vulnerability into strength and potential crisis into triumph. Even when the future feels uncertain, even when the body signals fragility, the human capacity to respond, adapt, and act decisively remains a constant. Suspense, while unsettling, is also an invitation, a call to awaken, to listen deeply, and to take control where control is possible. It is within this delicate interplay of unpredictability and preparedness that growth occurs, courage emerges, and resilience is forged. In understanding and responding to the sudden progression of CKD, we learn a universal truth, that life's most critical moments demand awareness, intentionality, and unwavering courage, and that even in the face of rapid deterioration, hope is never lost when we act with knowledge and purpose. As we move forward from the suspense of uncertainty into the clarity of understanding, it becomes evident that the journey of managing health, especially when facing chronic kidney disease, is a journey of both courage and insight. Each day presents choices, some subtle, some monumental, yet all capable of shaping the trajectory of our well-being. The wisdom of Dr. Mathew R. Weir illuminates this path, showing that proactive care, vigilance, and education are the tools that transform fear into empowerment and vulnerability into resilience. It is not enough to simply exist in the hope that circumstances will remain favorable. Life demands conscious engagement, an attentive eye toward the signals of the body, and a readiness to act when those signals demand attention. Profound beauty in this awareness, a recognition that the fragility of life is not a limitation, but a call to deliberate action and meaningful reflection. Understanding that infections, dehydration, or certain medications can accelerate kidney deterioration is not meant to overwhelm us. It is meant to equip us with knowledge and clarity, giving us the opportunity to prevent irreversible damage before it takes hold. This is where true empowerment resides, in the recognition that while we may not control every variable, we control our response, our preparation, and our commitment to health. The metaphor extends beyond physical well-being, reaching into the very essence of human existence. We are responsible not merely for surviving challenges, but for responding to them with awareness, dignity, and purpose. Dr. Mathew R. Weir, that underscores the importance of early recognition and intervention, reminding us that timely decisions can radically alter outcomes. The human spirit, like the body it inhabits, is capable of remarkable recovery when informed by knowledge and guided by intention. Each proactive measure, consulting healthcare professionals, monitoring symptoms, adjusting lifestyle choices, or adhering to prescribed treatments, is an act of courage, a testament to the human capacity to protect, preserve, and strengthen. These measures may appear incremental, almost inconsequential in isolation, yet their cumulative impact is transformative, shaping the course of health and the quality of life. There is also a philosophical lesson woven into this journey. Adversity, when met with knowledge and preparedness, becomes an instrument of growth rather than defeat. The sudden deterioration of CKD is both a challenge and a teacher, urging reflection on how vigilance, awareness, and action intertwine to create resilience. Life does not always offer warning signs, but when it does, the decision to heed them can be life-altering. Dr. Mathew R. Weir, that inspires patients to view each symptom, each subtle change, not as a threat to be feared, but as a message demanding respect, attention, and immediate action. The suspense of potential decline transforms into an opportunity for empowerment, illustrating a timeless principle. The combination of knowledge and deliberate care is the most reliable defense against uncertainty. Beyond the physical realm, this philosophy permeates our emotional and psychological landscapes. By learning to respond calmly and effectively to the unexpected, we cultivate patience, resilience, and confidence that extend far beyond health alone. Every step taken to preserve kidney function is a testament to human will and determination, a demonstration that even in moments of vulnerability, agency is possible. This perspective transforms the narrative from one of fear to one of hope, from fragility to strength, and from uncertainty to clarity. The unpredictability of life and health, while daunting, is an arena for practicing mindfulness, discernment, and courage. Each decision, guided by informed awareness, reinforces the principle that our actions today determine the outcomes of tomorrow. The teachings of Dr. Mathew R. Weir that emphasize the importance of education, vigilance, and timely intervention serve not only as medical guidance, but as a philosophical framework for embracing responsibility and cultivating resilience in all areas of life. The journey through sudden CKD progression is emblematic of life's broader challenges. They are tests of our preparation, awareness, and capacity to act decisively. But there is hope, and there is power in understanding. Knowledge transforms fear into a structured plan, uncertainty into clarity, and vulnerability into a proactive stance. By responding to early warning signs, by acting swiftly, and by nurturing both body and mind, we create the conditions for survival, recovery, and a higher quality of life. This holistic approach is a reminder that care is not reactive but intentional, not passive but empowered. As we conclude this journey of understanding, let the wisdom of Dr. Mathew R. Weir that guide us. Life, much like kidney health, is shaped by our attention, choices, and readiness to act. Every symptom acknowledged, every precaution taken, every moment of vigilance is a testament to the human spirit's capacity for resilience. Let us embrace this responsibility with clarity, courage, and unwavering determination, turning moments of potential crisis into opportunities for growth, empowerment, and triumph. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.